This is the site of one of the country's leading pleural effusion programs. Started in 2006, the Interventional Pulmonology program has helped thousands of patients suffering from a buildup of fluid around the lung.
We started with a pilot. We started with a very, very small pilot of 108 patients initially.
Since then, Dr. Kevin Amjadi has become something of a pioneer in Canada. Today, he's about to perform an outpatient procedure on one of his patients to insert an indwelling pleural catheter designed to help remove the fluid.
Judy saw us about a month ago. She had started to develop symptoms of shortness of breath, and that resulted in some investigations by a family physician who performed a chest x-ray and at the time identified presence of a moderate-sized right-sided pleural effusion and sent her to our pleural disease clinic. So what I'm going to do next is I'm going to use this to clean your skin, okay? It's going to feel cold again. It's going to feel a little wet, okay? Once we sampled the fluid, we were able to identify cancer cells, and the cancer cells were later on characterized as being related to a primary lung cancer. So she was diagnosed with stage 4 lung cancer. You know, it is advanced disease. This is stage 4 lung cancer. So we're not looking at curative measures. We're looking at palliative and perhaps, you know, improving quality of life and helping with the maintaining her quality of life. So next part here is going to be freezing of your skin, okay? Development of this catheter, it has become a lot safer and a lot easier for patients to have the catheter placed in an outpatient setting and then go home.
The catheter has become a game changer for patients requiring drainage of the pleural fluid. The buildup of fluid is a common symptom of cancer. Here in Canada, it helps to restore quality of life for about 3,500 patients a year. Previously, the only alternative was regular, lengthy hospital visits.
We often can reduce the frequency of drainage to sort of mitigate the cost of long-term drainages, and it has demonstrated significant cost saving, you know, from a healthcare perspective and also for patients and their families.
From the time the catheter is inserted and the bottles begin collecting the fluid, the whole procedure is done in less than half an hour.
We're dealing with end-of-life issues, and anything we can do to help patients maintain their quality of life and independence in their home environment is of significant value for them.
After a few stitches, the patient is up and ready to get back to her life. The impact is immediate.
How are you feeling?
Good.
Okay. Yeah. We're just going to take your blood pressure one more time.
Okay. I can breathe easier. And it didn't bother me getting it in. That's the main thing. I wasn't too sure just what it was all going to be like, but feeling as though I could go home and do something.
Dr. Amjadi is pleased with today's procedure, which has shown positive results.
This is her post-drainage x-ray, and this is her x-ray, most recent x-ray that was done this morning. She has no other major issues. The main thing that was restricting her activity was shortness of breath, which is why placement of the catheter will have a significant impact in her quality of life. She'll be able to resume her activities as she was before.
Dave, a cancer patient who had the procedure 2 months ago, can certainly speak to that.
There's no discomfort. You know, it's almost like an equilibrium has been established. I can go in there with 800 milliliters of fluid, have it drained off, come out. I just don't feel any different. And I don't want to say it cleared everything up, not by a long shot, but it made things better and easier to live with. Walking here, for instance, it's a non-issue.
Back at the hospital, Judy gets a few tips from the registered nurse.
You can then set your time, go to the clinic, get drained, and then go on with your business.
While Dr. Amjadi dictates his notes on the procedure.
Technology is very important in what we do. So we're very much linked with the industry in terms of developing new tools for mitigating risk and complications, and developing strategies to perform procedures in a minimally invasive way. So industry has been phenomenal help in developing these tools to help us explore areas that we couldn't do before.
Technology that's helped patients like Judy spend less time in the hospital and get back to their lives.
I'm looking forward to getting home and going ahead with my life the way I have been for the last almost 74 years. I've always been very independent, so I think I'll continue doing that.